Hello everyone, how are you all? Today let's continue 2022 anatomy paper. 15th one. Which ligament connects medial cuneiform to the base of second metatarsal? It is a Lisfranc ligament. Let's see the explanation. There are total 3 strong cuneo-metatarsal interosseous ligament. Out of that, one was asked in the question, that is which connects medial cuneiform to the base of the second metatarsal bone. The second ligament that connects the lateral cuneiform to the second metatarsal bone, whereas third one connects to the third, that is to the lateral cuneiform to the third metatarsal bone. Okay, it is connects to the base of the metatarsal bone. First one and second one connects to the second metatarsal, whereas third one connects to the third metatarsal, that is base of the third metatarsal. This first cuneo-metatarsal interosseous ligament is very strong, that is Lisfranc's ligament. Okay, they have asked that same question, medial cuneiform to the second metatarsal. Option C. 16th one. Which of the following structure passes via jugular foramen has a separate canal? Actually, this is something that is like acting like a hero who has a separate canal for himself. Who is that? That is the glossopharyngeal nerve. Which all nerves that passes to the jugular foramen? That is 9, 10 and 11th one. Whereas hypoglossal nerve has a separate hypoglossal canal. 17th one. What is the blood supply of the structure marked in the image? This is the anterior and this is the posterior side of the brain. Here this is the corpus callosum and they have marked anterior part of the corpus callosum. It is supplied by which artery? This question was the repeat question. Posterior cerebral artery is for the posterior part, that is splenium of the corpus callosum, but anterior cerebral artery is correct. Middle cerebral artery, no. In the medial surface, almost everything is supplied by this is the medial surface, everything is supplied by the anterior, this one, anterior cerebral artery, whereas some posterior little bit is supplied by the posterior cerebral artery. Here it is supplied by anterior cerebral artery and anterior communicating artery. Let's see. Anterior cerebral artery gives a pericallosal artery. It supplies the majority of the corpus callosum. Okay, and this PCA gives a posterior pericallosal artery. It supplies to the splenium of the corpus callosum, whereas anterior communicating artery gives a branch, median callosal or a subcallosal artery. It supplies the anterior part of the corpus callosum. This is the anterior part was marked in the question. So it is supplied by anterior communicating artery and anterior cerebral artery. Whereas middle cerebral artery also supplies, but it supplies the not a medial part, it supplies the lateral part of the corpus callosum. Okay. Hence here option is C. 18th one. Which marked structure causes lateral rotation and flexion and abduction at hip joint along with flexion at knee joint? Which among these muscle causes flexion at knee joint and flexion and abduction and lateral rotation in the hip joint? This is the favorite action of which profession? It is a tailor. Tailor actually needs this lateral rotation, flexion and abduction, and among this muscle one is called as Taylor's muscle. Which one is that? That is the sartorius muscle. See, this is going obliquely. It helps in lateral rotation, flexion and abduction at hip joint. Sartorius is involved in this action, and Taylor's muscle, it is called as Taylor's muscle and also the longest muscle of the body. Hence 2, that is B option. The rupture of penile urethra does not cause extravasation of blood into which of the following spaces? Actually, we know there are two pouch. That is, one is the superficial pouch and the other one is the deep pouch. The urethra comes like this. Okay, let's see the picture. This is actually a little bit complicated question. Whichever is needed, let's grab only that much information. That's more than enough. Okay, here you can see this is the pre-prostatic part of the urethra, whereas this is the prostate, this is the prostate gland, and this is the prostatic part of urethra. This is the membranous urethra and this is the penile urethra. In the question they have asked when there is rupture in the penile urethra, okay, the urine or a blood extravasation will occur to all of the following but not to which space they are asking. Okay, when there is penile urethra injury, the urine or a blood can go to the scrotum. Yes, here you can see scrotum. Yes, and also it can go to the skin. Yes, that was skin and around the scrotum. D X. Yes, it can go. And this is nothing but a superficial pouch, isn't it? So it can go to the superficial pouch. But rarely, but rarely, very rarely, it can go to the deep perineal pouch also when there is rupture in the bulbourethral gland duct. When this gland duct is ruptured, it can go to the deep perineal pouch, but it's rare. But it can't go to the ischiorectal fossa. See, this is the penile urethra. It can't go to the ischiorectal fossa, isn't it? So it can't go to deep perineal pouch also, but here the most better answer is ischiorectal fossa, where the urine or blood cannot extravasate. Okay, let's coming to the 20th one. The bleeding has shown in the image is due to which of the following vessel? Here the bleeding is, you can see, under the dura. This is the dura mater under the dura. That means subdural. It is not above the dura, that is extradural. It is below the dura in the arachnoid matter. This is the subdural hemorrhage. Okay, subdural hemorrhage is due to the bridging veins. Here let's see the other bleedings. Extradural or epidural is due to the middle meningeal artery rupture, whereas subdural is because of bridging veins, whereas subarachnoid is below the arachnoid is due to the arterial. Main most common cause is trauma, whereas second most common is aneurysm. Intraparenchymal hemorrhage, that is within inside the brain parenchyma, that is most common site is putamen of the basal ganglia. Most common cause is hypertension. So here it's because of the bridging veins. 21st one, which of the following statement is true about internal capsule? Here, let's see, break down the question. Charcot's artery supplies the posterior limb. Yes, actually the Charcot's artery is a branch of MCA, that is middle cerebral artery. It supplies posterior limb and also the genu. Whereas retrolenticular part of the internal capsule contains optic radiation. This is also a correct one. Anterior limb of the capsule contains corticospinal tract fibers of the upper limb and space. If you got a case on stroke, the lesion in the internal capsule, do you remember lesion in the internal capsule? That is in the posterior limb, not the anterior limb of the internal capsule. Let me again show you the picture, you will come to know. Internal capsule has a projection fibers. Yes, correct. So everything 1, 2, 4 are correct. Only 3 is wrong. So all options are gone because of 3. If you know 3 is wrong, then you can directly mark option C, isn't it? Let's see. This is the internal capsule. Okay, this whole thing is internal capsule. The first option was the Charcot's artery supplying the posterior limb is correct one, whereas anterior limb is supplied by recurrent artery of Habenure, that is a branch of ACA, that is anterior cerebral artery. Okay, this is the genu. Genu contains a corticonuclear tract. NU, you can remember, genu, new corticonuclear tract, that is for upper motor neurons. Okay, whereas the posterior limb contains this whole thing is there. No, in this anterior two-third of the posterior limb has a corticospinal tract. Okay, whereas this is the retrolentiform and this is the sublentiform. Below means sublentiform. This retrolentiform, this is there in the one option, that is retrolentiform contains a optic radiation, hence this is correct. Whereas sublentiform contains auditory radiation. Yes, first eyes, isn't it? Then ear. So up one is retrolentiform which contains optic radiation, whereas down one, that is sublentiform, contains auditory radiation. Okay. What this anterior limb contains? There frontopontine fibers are present. If there is a lesion, there might be confusion, impaired attention, and agitation, dysarthria. Whereas if posterior limb is present, there will be which tract? Corticospinal tract. But in the option they have given this corticospinal tract present in the anterior limb. It's wrong. It's present in the posterior limb. Okay. Posterior limb, if there is a lesion, then you can get a contralateral hemiparesis and contralateral hemisensory deficit. This is the most common stroke patient will present with these symptoms only. Okay. Internal capsule predominantly contains projection fibers, that are the fibers that projects from higher to lower centers and vice versa. Okay. So option is C. Whereas 22nd one, fracture of jugular canal can present as. Okay, we in the previous question we saw jugular canal contains a which all nerves? It is 9th, 10th and 11th now. So here they have given only tongue. Okay, related to the tongue. Which nerve supplies to the tongue? 9th, that is a glossopharyngeal nerve, supplies to the tongue, whereas vagus also supplies to the tongue, which is very posterior most. Okay, let's see the options. Loss of taste sensation in the anterior two-third of tongue. Why there will be a loss of taste sensation in anterior two-third of tongue if there was a injury to the jugular canal? It will not be present because taste sensation in the anterior two-third of tongue is supplied by chorda tympani. You can remember tympani, T for T, taste. Chorda tympani is a branch of facial nerve. Whether the facial nerve is present in the jugular foramen? No. Hence, if there is an injury to jugular foramen, the facial nerve will not get affected. And the loss of general sensation in the anterior two-third of the tongue. The general sensation is by the lingual nerve. Lingual nerve is a branch of mandibular nerve. Let me show you the picture. Lingual nerve is a branch of mandibular nerve, that is the trigeminal nerve. Hence, jugular foramen does not contain again mandibular nerve. Hence, no effect to the anterior two-third will not get affected. Whereas the posterior one-third of the tongue, the both general sensation and the taste sensation is supplied by the glossopharyngeal nerve, and also this is one exception. This nerve from posterior it's supplying the anterior part, that is to the circumvallate papillae, but other all papillae are supplied by the chorda tympani only. Okay, the posterior most part of the tongue is supplied by the vagus nerve, superior laryngeal nerve. Muscles of the tongue derived from the occipital somites. The hypoglossal nerve, this supplies all the muscles except palatoglossus, which is supplied by the laryngeal plexus, which is supplied by vagus nerve. Okay, here let's see the options. This is wrong. Anterior two-third of tongue has nothing to do with the jugular canal. Loss of motor sensation in the anterior two-third of tongue. It is given by the hypoglossal nerve. Again, hypoglossal is a hero who has a separate canal, that is hypoglossal canal. So only loss of taste sensation in the posterior one-third of tongue will get affected in as given in this option. Okay. 23rd one, identify the liver segment marked in the image below. See, this type of questions are something bouncers because we are not radiologist, isn't it? But we have to identify now which is this segment. First of all, let's think this is the portal vein. Here in the liver, you can't see anywhere the portal vein. So it is before dividing the portal vein. So this cross section is taken below or just below at or at the portal vein bifurcation, hence the marked area is the fifth one. Okay, let me show you the pictures, but don't bang your head on this question. Okay, see, this was the cut section they have taken. So this is the fifth segment. You can see here also, this is the portal vein. Here this is the fifth one. But after dividing, see this here white structure you can see, right? These are the portal vein has divided left portal vein. Okay. See, other example I can show. This is after bifurcation of the portal vein, and you can see here two portal vein segments you can see. Hence, this is above the portal vein bifurcation. You can see eighth and 4, 2 or 3. You can see seventh segment also. Here you can see 7, 8, 4, 2. Okay. Here you can see this all things. That is 6, 5, 4 and 3. This down segments you can see when you take a section below. Okay. Fifth segment.